benefits of shared care arrangement? Well, probably the main one is that shared care clarifies responsibilities for all those that are involved with shared care. So that is the patient, the specialist provider, the primary care provider, or any other providers that might be involved. We tend to think that shared care just happens, and of course, there is a lot of sharing of care in the healthcare delivery, but it is often a little bit unclear of who's responsible for what. So the patient may not be sure whether they follow up refills of their treatment, like hormonal treatment is provided by the specialist or by their GP, medical oncologist, radiation oncologist. Who do they go to if they have a problem? How often do they need to have regular follow-up versus follow-up because an issue arises? Having a shared care arrangement that is a little bit more explicit allows us to clarify who does what and when, and make that clarification explicit. So if something is not appropriate, the party involved can actually flag it. So for example, oncologists may say, it's important to manage your blood pressure control, and perhaps your GP is the most appropriate to do that. Whereas if you need a refill, you could get it here or there. And I think that with the IBIS study, those decisions are discussed and made upfront, so everybody is clear, and then the patient can actually concentrate on planning their day and they follow up early, exactly within what is achievable, what is realistic, and what is acceptable. Traditionally, survivorship care was initiated and delivered in the specialist setting, where the focus of the care has been on cancer itself. And very often there was this assumption that the shared care and engagement of primary care providers was really at geographical shift of care from the specialist setting into the hospital setting, but delivering the same type of care. I think we really have an opportunity to take advantage of the expertise that primary care provides, and that is seeing the patient in the holistic way, in recognizing that they have other health problems that require attention, whether they are mental health issues or obesity or inactivity, or issues that might relate to the care of them in the context of the entire family. And that's something that GPs often do even better than specialists and are more aware of it. And I think that through sharing care, we really take advantage of that untapped resource where GPs are better than specialists at delivering care. This is not meant to be a GP being a substitute to a specialist, but rather a GP being an equal partner, using their own unique expertise and making that expertise accessible to the specialist. And I think that that's an opportunity in delivery care, rather than a way of shifting care from the specialist to the primary care setting. Historically, GPs don't necessarily appreciate being expected to be mini oncologists. They have their own skills, and some of those skills are much better than my skills as a medical oncologist. So I think that true sharing of care is really a partnership. And that partnership also involves the patient. So the patient is not just a passive recipient of the benefits of the GP's knowledge or a specialist's knowledge, but equally the patient plays a role in recognizing what they can do for themselves and how they can effectively navigate that process. And this is where making the process explicit is really important. So patients knows how to take advantage of the care plan that is provided to them, as opposed to trying to navigate the unknown. depends really at what stage of the process we're considering toxicities. And I think that there are multiple steps here. The first one is prescription of the drug. And when the drug is prescribed, usually by a specialist, there is some initial conversation with regards to what to expect regarding what is normal with regards to how treatment is tolerated, what side effects to expect, and how to potentially manage them. And that initial discussion should really prepare the patient of what is normal, what is abnormal, how to seek help, and where, if there are any other issues. Then the next step is dispensing of the medication, and very often the pharmacist would be involved in the discussion about what to expect about tablets, how to take them, how to identify any information that is attached to the tablets, and so on. And then part of the discussion is also who provides a repeat prescription, and that can be a specialist provider or primary care provider. With the IBIS study itself, there's also a nurse coordinator who would undertake some discussion with regards to expectations and management of problems and who to call if there are any issues. And then the patient has an option of addressing things during their routine visits with any of the providers, or might and should really have a plan for calling for help if there are issues that arise. So the management of side effects really involves self-management on the part of the patient and reaching out to the healthcare providers for assistance if any problems develop. So the IBIS study is not about reducing patients' appointment. The IBIS is a pragmatic study that looks at improving the quality of care that the patient receives. And we already recognize that it takes more than one healthcare provider to deliver optimal care. And this is a way of ensuring that the patient gets the right care depending on what their need is. And if the patient requires additional appointments because they have additional needs or additional concerns, those appointments should take place so we can actually deliver the best care rather than the cheapest or the briefest care. So there is really no need or no concern that the healthcare provider should be restricted in any way in delivering care that they consider appropriate. And some patients will have less care because the care is not required, but there'll be other patients who may have more care, and that's perfectly appropriate. And the study will document it, and we'll learn from that research for that very purpose.